CAR T-cell therapy is an advanced immunotherapy used to treat certain types of blood cancers, especially when other therapies have not worked. The method involves taking a patient's own T-cells, a type of lymphocyte, and genetically modifying them in a laboratory. They are then given a chimeric antigen receptor that allows them to recognize specific antigens present on the surface of cancer cells. This complex process is what makes the therapy so expensive. The modified T-cells are then returned to the patient's body, where they begin to specifically attack tumor cells. In Germany and other countries where this treatment is practiced, CAR T-cell therapy is primarily used for the following diseases: acute lymphoblastic leukemia, B-cell lymphomas, multiple myeloma, mantle cell lymphoma. Before CAR T-cell therapy can be started, the patient must undergo chemotherapy to free up a niche for new T-cells. Blood is drawn from a vein. The T-cells are isolated through a process called leukapheresis. The collected T-cells are frozen and sent to a laboratory, where they are genetically modified to express CAR, multiplied, and tested. This process takes about 4 weeks. The patient's own T-cells have already been almost completely destroyed by the chemotherapy that was administered beforehand. So the modified CAR T-cells that are now injected begin to perform their function. Patients are closely monitored in the hospital for potential side effects. This period can last 2 to 4 weeks. Of course, regular follow-up is necessary to monitor the patient's response to the therapy. This therapy has significant side effects that require great attention. That is why patients are hospitalized in specialized centers with the relevant experience for this treatment. The most common side effects include inflammatory reactions, problems with the nervous system, headaches, seizures, and cytokine release syndrome, high fever, chills, skin rashes, respiratory complications, kidney and liver failure. This syndrome, at the same time, is a sign that the therapy is working. The long-term effects of CAR T-cell therapy are still being studied. An important issue is its potential carcinogenicity. Tens of thousands of CAR T-cell treatments have been administered worldwide. Clinics are required to monitor patients for at least 15 years. And so far only a few dozen cases of CAR T-cell therapy-associated malignancies have been reported worldwide.